Hi, this is Dr. Phoenix. Today I'd like to show you the bones of the skull and face and some of the bony landmarks that you'll need to know for your quizzes and your test. To start out with, we have a lateral view of the skull here, and I will show you the bones that are obvious from each view of the skull, and please know that during the tests and the quizzes I will always give you the most obvious view. So on the lateral view we can see the frontal bone here, which is the forehead. We can also see the parietal bone, which makes up most of the top of the head. There are two parietal bones, one on each side. The temporal bone right here, which obviously makes up your temporal area. There are some parts to the temporal bone that I want to point out to you. First of all, the external auditory meatus is the canal that your ear canal is running through. Your ear canal runs through the temporal bone. The external auditory meatus. Behind your ear there's a fairly large bump. You can feel it. It is kind of a air-filled bony protuberance, and it serves as a attachment site for a fairly large muscle in your neck that we'll get to in the muscular system. This is called the mastoid process. The mastoid process. Right in front of it, a little bit deeper, there's a tooth-like projection, and it is called the styloid process. It also serves as muscle attachment for the tongue and muscles involved in swallowing. And the fourth part of the temporal bone that I want to point out to you is this ridge right here. This is called the zygomatic process of the temporal bone. If I change the angle here just a little bit, you'll see that this let's do the inferior view. There we go. You see that this zygomatic process makes sort of a bridge, and there is space underneath here for a muscle to travel through. So the zygomatic process is part of the temporal bone. Muscles will attach to it on the outside, and muscles will run under it as well. This bone right here that makes up your cheek is called the zygomatic bone, as compared to the zygomatic process of the temporal bone. The lower jaw is the mandible. It is the only bone in the skull that has a freely movable joint, and this is called the temporomandibular joint, the joint between the mandible and the temporal bone, the temporomandibular joint. And this is the lower jaw. The upper jaw, where the top teeth are located, is called the maxilla. The maxilla. We can also see the nasal bone here, just on one side. Okay, so let's look at the anterior view now of the skull. Again, we can see the nasal bones. Here again is your frontal bone and your maxilla and your mandible and your zygomatic bones on both sides, your cheekbones. Now within the nasal opening there are a couple of structures that I want to point out to you. This ridge of bone right here that makes up the lower portion of the nasal opening, sort of a divider between the two nasal cavities. This bone is called the vomer. The vomer. Also, there are shelf-like projections on each side of the nasal cavities, and there are actually 3 shelf-like projections on each one. Can't see the most superior one, but this one right here is generally visible, and it is called the inferior nasal concha. The inferior nasal concha. All right. Now, within the, well, let me come back to that actually. So let's now look at the back of the skull. So we can see this bone in the back of the skull. This is called the occipital bone. The occipital bone. And again, on either side at the top of the head, these are your parietal bones. So while we're here, let's label the sutures that I want you to know. And I want you to know 4 sutures. And the 4 sutures that I want you to know are the sutures that border the parietal bone. So there's a suture in front of it, on the side of it, behind it, and then there's a suture that separates the 2 parietal bones. So first off, this suture right down the center that runs in the sagittal plane is called the sagittal suture. That's easy enough. This suture right here, separating the parietal from the frontal bones, runs in the coronal plane, and it is also called the coronal suture. So those 2 should be easy to remember. On the side here, this suture has a little bit of an S shape to it, and it is called the squamous suture. The squamous suture. And then the suture in the back that separates the parietal from the occipital bones, this suture is called the lambdoid suture. Lambdoid suture. Okay. So let me change views here. Let's look at the skull now from the inside. So we're going to be looking from top down with the top of the skull removed. So first off, I want you to see this big hole that is located in the occipital bone actually, and this is called the foramen magnum. The foramen magnum. There are 2 bones that I'm particularly wanting you to know from the inside of the skull that make up a portion of the floor of the skull. This bone right here that I'm outlining with my mouse arrow is called the ethmoid bone. The ethmoid bone. And the ethmoid bone has 2 parts. This part right down the middle is sort of a ridge, and it is called the crista galli. Crista galli. And then on either side are 2 plates that have holes in them that are called the cribriform plates. And these holes are for neuron projections to go down through into the roof of the nasal cavity. They project off of the olfactory bulbs that are located right here, and they serve as the receptors for smell. Okay, now the next bone that I'm going to point out to you doesn't show the boundaries on this particular view very well, but it's this area that I'm pointing out to you with my cursor again. It's sort of a bat-shaped bone. It makes up a good portion of the floor of the cranium, and this is called the sphenoid bone. Sphenoid bone. And right in the center of the sphenoid bone is a little cup-shaped structure that helps to support and protect a very tiny gland that projects off the inferior part of the brain, and that is called the pituitary gland. The pituitary gland. It sits right in the sella turcica. Sella turcica means Turkish saddle. Okay, so from that view I think that's all. So now let's look at the inferior view. I could have kept that one up there, the inferior side. And again, I want to point out to you a couple of structures. Once again, here is the foramen magnum, which is part of the occipital bone. And I also want to point out these two joint surfaces on either side of the foramen magnum, and these are called the occipital condyles. These joint surfaces will articulate with the first vertebrae of the spine, which is called the atlas, and this will form the atlanto-occipital joint. Again, notice the zygomatic process right here, which makes up the zygomatic arch. The hard palate is another structure I want you to be familiar with. The hard palate is most of the top of the roof of your mouth, and the front 2/3 to 3/4 of it is hard, and the posterior portion of it is soft, which is a mucous membrane covering muscular tissue primarily. But the bony hard palate consists of two bones that I want to point out to you. These two plates right here are called the palatine processes of the maxilla. They are part of the maxilla, and they are the palatine processes. These bones behind it are called the palatine bones. They are their own bone. Palatine processes are part of the maxilla. Palatine bones are their own bone. There are also 6 bones in the eye socket that you'll need to be able to identify. And let me show you how I have learned to identify them in the easiest way. 5 of the bones we've already learned. There's only one new bone. So let's show you how we do this. Let's just reposition this so that's in the center. All right, so we're looking at the right eye. This up here is the frontal bone, and so if we just look at the top bone in the eye socket that makes up most of the roof, that is the frontal bone. This bone over here is zygomatic, and most of the bone that makes up the lateral wall is the zygomatic bone. This is the maxilla, and most of the floor of the eye socket is the is the maxilla. Now in the medial corner of the eye is a new bone, and this is called the lacrimal bone. Right in here is where you have your tear ducts. They're called lacrimal ducts, and so this is called the lacrimal bone. Next to it is the ethmoid bone, which we learned from the top inside of the skull. And then this bone right here is the sphenoid bone. Okay, so frontal, zygomatic, maxilla, lacrimal, ethmoid, sphenoid. And there you go, that's the bones of the eye socket.